Hi everyone, my name is also and today I'm presenting on project Clinic Cube. We have all experienced the frustration of visiting a clinic, waiting in a crowded reception area, not knowing when we'll be attended to. This situation can be stressful for patients and can also make it difficult for healthcare providers to manage patient flow efficiently. To address this challenge, we developed Clinic Cube, a smart healthcare application designed to improve appointment booking and queue management for both patients and doctors. For patients, ClinicQ provides a simple way to search for available doctors and specialists based on their needs, book appointments, and monitor their queue position in real time. Instead of spending long hours waiting at the clinic without information, patients can receive updates and know their expected waiting time. This reduces unnecessary delays and creates a more convenient healthcare experience. Application also has a dedicated section for doctors. Doctors can manage their appointments, view their current patient queue for the next patient, update their availability, and manage their professional profile. These features help healthcare providers organize their work better, reduce confusion, and improve the overall consultation process. Important of clinic queue is that it creates better communication between patients and doctors. Patients can plan their visits more effectively, while doctors can have better control over their schedules and patient flow. Overall, ClinicQ provides a simple and efficient platform that connects patients and healthcare providers by combining appointment booking with real-time queue management. The application helps create a smoother, faster, and more scaled experience. Thank you.
I'm Humphrey Baby, a member of this team working on this capstone project, the Clinic Q app. So before anything, the Clinic Q app is just an app that allows patients or people going to attend the hospital kind of book an appointment before they reach the hospital. So it's just an electronic queue. The queue is done, but not physically, but on the app, we are able to regulate the entry of patients into the consulting room of hospitals. Now, before the app loads, there's a clean splash screen that has the logo on it. We just made it clean and lightweight. So this is the onboarding screen. And on the onboarding screen, it basically shows the user or the patient the core values of the app. So you can see here your health journey starts here. Skip the waiting room, track your position in real time. So basically what I was talking about is what we have here. So the core values of this app is just like the about us page of any website around. So you slide to get started. So let's slide. So after you slide, you can see you have been brought to the login screen. Now for a new user, he cannot enter any details here, or if the user enters a detail, because we do not have the essential information or data from the user who has already signed up, or because he's a new user, his details are not in our database. So the new user will have to sign up. So we have to sign up. There's a sign up here which says if you don't have an account, you basically sign up. So we clicked on the sign up. Yes. Now we can see the essential data we need: your first name, surname, email, phone number, and password. The second is just basically to confirm that password is already entered. So on to the first name. So we have just signed up. After signing up, you can see you have been brought to the queues page where the queues are. Currently, there are no active queue tickets. So what we will do is now go back to check if our data has been saved. So we are just signing out. Yes, now onto the login page. We can enter the details we entered. Yes, so we are going to do that. Then the password. Login. Yes, you see now we've been logged in. This is your profile, yes, where your details are. You can go back, then continue with the booking. So this is my part. Thank you.
Okay, so I'm Jeffrey Atamani, and now let's look at our patient's view of the home screen of our Clinic View app. So when you look here on the home screen, you can see that we have a portion for active tickets. That's like active queue tickets, telling you which queue which queue number you are. And below you can see that we have our quick actions buttons, which is telling us which enables us to book an appointment, view our appointments that we have, and also leave a queue if you want to. So now let's tap on book appointment to book an appointment and see how it goes. So when you click on book appointment, you can see that we are brought to a screen where it's showing us the various doctors who are there, those who are available and those who are unavailable. If you want to see those who are available, you tap on available here, and only those who are available show up. When you tap on unavailable, those who are unavailable at the moment, they are the ones who show up. So now let's tap on available and let's book an appointment with one of the doctors. So now I want to see the dermatologist, since I have some form of rashes or something, and I want to check that maybe it's something serious, maybe it's not something serious. So let's first view his profile to be sure and be confident that okay, so yeah, he's a doctor of the skin. So as you can see, when you look here, you can see that everything about Dr. Petro is being shown here, the days that is available and also the time that is available. So let's go ahead and book him. Yes, and since we saw the time that he was available and the time that the date is available and the time that is available, we will continue that way so that we don't cause any issues for the doctors, since we also need to have their time to also do other things. So when we come here, we will leave the dates and the times selection part as it is. Then for the reason, we'll pick new consent because he's a new this is our first time going to see him. So we'll pick new consent and confirm booking. And when we confirm booking, it brings us to the screen where it speaks about which shows us that our appointment has been confirmed. So when you tap on that live queue, you can see that yes, if we booked an appointment with Dr. Petro, let's go back and yes, when you click on view my appointments queue, yes, you can see that Dr. Petro is booked here. This screen is my appointment screen, so the upcoming appointments that we've booked, yes, we'll see it here, and also we'll also see the past appointments. When you check the past appointments here, yes, you can see that we've had appointment with Caleb Thompson and Dr. Opoku, but we cancelled it. So let's continue. Then when you come back to the home screen and tap on the icon here, you can see that it has brought us to my profile, which gives me a summary of my details that I've used to log into the application. Now, if I want to edit my details, I just go to personal information, and you can see that all my details here can be edited, and I can edit it as to my preference. Let's come back to my appointments. You can see here too that my appointments too that we saw earlier on will also display your present upcoming appointments and also your previous appointments. So yeah, with this app, administrative workload and queue anxiety on patients is removed and eliminated, thereby easing stress on both the patients and also the staff. And this will go a long way to help your hospital if you implement.
Good morning, everyone.
My name is Kosu Patrick Sedofia, and continuing from where my colleague ended, I'll be showing you guys a live queue tracking interface, which is what you can see on your screen right now. Yeah. So this is basically a digital replacement for what goes on in a waiting room where the patient will have to wait for the the doctor he has an appointment with. So this is a very efficient way as it lets the user know his or her ticket number, why the patient has to wait, and how long it takes for the patient to meet with the doctor he or she has an appointment with. Okay. So going into detail, what you can see at the topmost part of the screen is just displaying the name of the hospital, which is Kolebu Teaching Hospital. And moving on is the ticket card, which is the most important part of the live queue tracking interface. So this shows the patient's ticket number, which is A12. And right below it is a progress bar that shows how long it takes for the patient to meet with the doctor the patient has an appointment with. So it also shows the number of patients right below it, which is 4 patients. So before the patient meets with the doctor he has an appointment with, 4 other patients are ahead of the patient, ahead of him or her. And below shows the estimated time and the patients they are serving now. It shows the patient ticket number, that is 18. So you have to wait for some time as ticket number 812 before you meet up with the doctor you have an appointment with. All right. So right below it is shows the journey progress. So looking at it, we have 4 stages to it, which is the booking stage, arrived at the clinic stage, consultation and serving stage, and the last and final part, which is the finish stage. So as you can see right now, only the first stage is in progress as the booking is being confirmed. Yeah. So the second to last part is the part with the live insights. This just shows why the patient has to wait for that amount of time, and the doctor availability and the clinic occupant. Yeah. So lastly is the leave queue button. So if the patient maybe grows frustrated or can't wait any longer, this button is there to allow the patient to leave the queue. Okay. Thank you very much for having me again. My name is Patrick Kosu Sedefia.
So here we can see we have the doctor's dashboard aside the patient's dashboard. So here what you can see here is the doctor's full name, the specialty, the experience, and when we go to the dashboard itself, we have the availability button which you can toggle on and off. So here when you toggle it on, it shows that currently taking patients. So it sends an information to the patient dashboard showing that the doctor is available and is currently taking patients. When it's turned off, it means the doctor is not available. So on the patient's dashboard, you will see that the doctor is not available. And here we have now serving. So the now serving button here is for patients that are currently in the consultation room of the doctor. And here we have the call next patient. So as soon as the first person is done in the queue, it press calls next. Then it sends a message to the patient who is next. So let me say if I'm currently working with the consultation room with the patient 1, as soon as I'm done, patient 1 will be in the now serving what's the name box over here. Then patient 2 will be somewhere here in the query list, in the queue list here. So as soon as I'm done serving with patient 1 and I call next to patient 2 comes into the now serving, then it sends an information to patient 2 that you are next. So the availability toggle button here, the purpose is just to show that if the doctor is not available, rather than the patient coming from the house to come and book the doctor, it actually saves time. So assuming there is a case that the doctor gave you an appointment that, okay, you went there and the doctor told you should come back in 2 weeks time. So in 2 weeks time, before you come, you book an appointment with the doctor. So when you enter the patient's dashboard and you realize that the doctor who asked you, who issued you to come in 2 weeks' time is not available now, it saves you time and money rather than coming from the house and coming the doctor, they tell you the doctor is not available. So that's the reason why you place the availability status button over here. Yeah, so currently there are no queue, no appointments over here. That's why everything is 00000. That's all.